What is transitional care management and how can a pharmacist bill for it? Find out next. Hi, I'm Blair Thielemeyer, and I work with pharmacists who want to build and grow their advanced clinical pharmacy services. Today, I'm going to be talking about transitional care management. First thing I want to talk about with transitional care management is eligibility criteria. So transitions of care count if the patient is moved from an inpatient setting, that could be a mental health facility, an emergency department, even an inpatient hospital setting, to the patient's community setting. That community setting could be home, an assisted living facility, or even some type of community nursing facility. One thing I love about transitional care management is it can be offered as a standalone service, or it can be integrated in with an existing chronic care management program. There are two CPT codes for transitional care management, 99495 and 99496. Let's talk about the code 99495 first. So this code is reimbursable at $164 for a non-facility setting and $135 for a facility setting. This code is for a 48-hour post-discharge contact, which can be done telephonically, via telehealth, or face-to-face, and a 14-day post-discharge follow-up that is face-to-face. The 99496 code is reimbursable at a rate of $231 for a non-facility setting and $197 for a facility setting. The difference here is you still have the 48 hours or 2 business days afterwards to make the primary touch point with the patient, but you have to make the face-to-face visit in 7 days of post-discharge. With either of these codes, the first touch point can be done telephonically, 2 days to 48 hours post-discharge, and the second touch point has to be done face-to-face, but it can be provided in the patient's home, in the provider's office, or in another primary place of residence. Both of these codes should be used for moderate complexity decision-making and can be offered by a clinical consultant pharmacist under a collaborative practice agreement. So as I mentioned, clinical consultant pharmacists working off-site under a collaborative agreement with a physician can offer the first touch point using these transitional care management codes. Some of the components of what you could offer during that visit is medication reconciliation, communication between the patient and their caregiver with the follow-up provider, and helping plan that follow-up appointment that's going to occur 7 to 14 days later in person, access to care services that the patient may need or family members may need to support that person, reviewing a need for any follow-up tests, drug monitoring, or additional treatments the patient could need. And if the patient is part of your chronic care management program, of course you would continue to follow that patient there the next month and throughout their care. The transitional care management codes may be used on new or established patients. I think the transitional care management program is a great opportunity for consultant pharmacists to be able to offer their expertise and assist providers in helping ease patients with transitions of care. So if this video was helpful for you, please consider subscribing to our YouTube channel and sharing it with a colleague. And if you're interested in getting more information about pharmacist-led clinical services, join the Pharmapreneur Community newsletter at btpharmacyconsulting.com.